So I am recording. Okay, can you see that?
Yes.
Okay, cool. So this is what she goes through. She goes through 2 of these test taking exercises that we got from Elsevier. She goes through the basic principles of nursing practice to guide your critical thinking. She reviews what questions look like, how to break them down, what are the priority needs. All right, so that's the first PowerPoint presentation she goes through. Okay, and then she goes through this critical thinking fundamentals practice questions. Okay, so she goes through very detailed, I think there's 10 questions, very detailed. How to frame, is the question positive? Is it negative? What are the keywords to pull out? How to pull the keywords out? So her review is primarily on test taking skills. Okay, so again, it's, I think, 42 minutes. I would highly encourage you to watch that. Okay, because I'm going to cover content. I'm going to go through the study guide and show you how we organize a study guide. And then we are going to go through this document. This is a spreadsheet that we made a couple of terms ago. It has 1, 2, 3, 4, 5, 6 sections. Okay, and that is actually we have reviewed the topics that HESI and the concepts that HESI is covering over the last 18 months. Okay, so we don't know the questions. We don't do the HESI. We don't develop the HESI. It's developed like NCLEX. Okay, so it comes from a bank of hundreds and hundreds of questions, but we can review the HESIs with regards to topics that are covered or questions that might be potential topics and questions. So what I'd like to do is go through that Excel spreadsheet, at least look at the topics and concept that are presented as part of the HESI. And then we can kind of do what I like to do during reviews is let's try and figure out what kind of question they might ask. So I don't know what the questions are, but I do have an idea of the topics that are covered. Okay, my group last night found this very helpful. But first, let's go through the study guide and I'll show you how it's organized. Okay. Does anybody have any questions before we get started? Okay, everybody has a study guide, correct? Anybody not have their study guide? Okay, that's a good start. Okay, so let's go through study guide. Okay. We, as always, this is not an all-inclusive study guide, but it is a very detailed study guide. So questions are randomly selected, much like NCLEX. It's hard to predict what questions will be on the term, but we can try and predict what questions might be asked based on the topics that have been covered in past HESIs. Okay, so some helpful hints for success: review your exam study guides for this term. Just said that you have 3 of them. Okay, review your ADPI, priority type concepts, safety and management. We've covered that all term. We've covered primary, secondary, and tertiary all term. Right, remember that physiological trumps psychological. ABCs are number 1. Okay, NCLEX questions, your evolved case studies, your group projects, your homework, all of this has prepared you to take this exam. Okay, Kaplan is that's our assignment this week. Kaplan is probably the most similar activity you will do that mimics the HESI and the NCLEX. So when you're doing Kaplan, please, well, number 1, everybody knows that you have to remediate every single question, even if you got every single question right. We all know that, right? You still have to remediate 30 questions. Okay, and the purpose of that is we want you to read through the rationales. Okay, take good notes. Rationales are super helpful. Okay, and then if you took the opportunity to review the exams with your instructor after the exams were given during the review period, you should have a good understanding of what you missed on the previous 3 exams. If you didn't, you didn't. Remember to apply the principles of clinical judgment nursing process. This HESI is very med-surg focused. Okay, so you'll be bringing in your med-surg skills. And we need to also think about safety and delegation. Okay, so that's an overview. So this HESI is broken out into several concepts. Okay, they're highlighted. Each concept is highlighted in red writing with yellow highlighting. So this is how it's organized. So we've gone through the most important concepts we've been covering all term. So the first concept we are discussing here is population groups across the lifespan. What are the health risks? I'm not going to read through this. You can. I'm just showing you how it's organized. I want to get to that spreadsheet of topics. So this is 12 pages, this particular concept. And it goes through what are the groups we talked about during the term. Okay. We talked about we talked about infants. Okay, we talked about children. These are different populations. Okay, playing tricks on me here. Infants, children. We talked about school-age children. We talked about adolescents. Okay, these are all the different groups. Okay, and again, these are summaries. Okay, we talked about women's issues, men's issues, elderly issues. So this section goes through each of those groups we've talked about and gives you a summary. What are health risks? What kind of education does this group need? Okay. All right, so that is the first concept. Okay, and this is all related to health risks across the lifespan. And in each section, we try and give you each concept area, we try and give you some examples of levels of prevention. Okay, so for this, health risks across the lifespan, here's our levels of prevention. Okay, primary, secondary, tertiary. So read through those in each of the sections. Okay, and then we pulled this out of the book for another example of levels of prevention related to public health. What I would suggest you do is go through your 3 study guides, go through this HESI study guide, attend your exam reviews or your HESI reviews, however many you're going to attend. And then I would make a list of concepts or information or topics or parts of the study guide that you still don't understand. Okay, maybe go back to the book, read a little bit more in detail about what that is or what that area, that topic is. And then if you're still not understanding certain things, make an appointment at the end of the week, over the weekend, with your instructor before you take the HESI next week. Okay, that's my suggestion. Okay, you've got to do your part. I'm happy to do my part in working with anybody who needs help. But I need you to do your part on the front end, which is going through all the information and really singling out what you truly don't understand. Okay, is that fair? Okay, second concept is specialty nursing. Okay, what did we talk about over the term? We talked about the school nurse. We talked about the faith community nurse. And we talked about the hospice nurse. And this should actually be hospice home health nurse, right? Because we did that together. Hospice home health. Okay. So we need to be aware of those 3 specialty areas of nursing. Whoops, just trying to let people in. School nurse, faith community, hospice, and home health. Okay, our next, this is another large topic or another large concept that covers several pages, which is what's the role of the nurse? Okay, there's lots of things discussed in this section. Okay, what is our role? What is our role in family assessment? Here's where it discusses the difference between the EcoMap and the genogram. And we do have, that's one of the topics that are covered on the HESI, looking at previous HESIs, is there's a question about EcoMap. Okay, so know about your eco maps and your genograms. Again, we went through this in class. And we also talked about prevention strategies for violence. What is our role? Right? What is our role at the individual and family levels? What is our role at the community level? Okay, what is our role here in working with vulnerable populations? Okay, so I'm just trying to organize it for you so it doesn't seem so overwhelming. Okay, what is our role? Remember, we talked about financial, legal, and ethical, professional negligence. What is our role in all of that? This goes through and explains all that. What is our role with regards to using our ethical principles? And what are they? Here's your 4 ethical principles. We need to have an understanding of those. Okay, and then lastly, some professional tips. What are some tips for actions for us as nurses in our roles and how we can contribute? Okay. Next section was the program management. Okay, how do we establish programs, right? Program management, and remember, think ADPI. Program management is just like nursing process. You're using your ADPI, it just looks different, but you're still using the nursing process. How do you develop a program? How do you look at outcomes? I mean, remember the last part of ADPI is evaluation. Okay, so evaluation would be program outcome. How do we assess the outcomes of our programs? How do we measure the outcomes? Here's our section on primary, secondary, and tertiary with regards to program development. Okay, here's a section on evaluating outcomes, part of our ADPI. So that whole section is program development. And then we have the next section is infectious diseases, where we go through the epidemiological triangle. Remember that? We go through the agent, the host, and the environment and how those interact. Okay. Then we go through, we've seen a couple of questions, or at least the topic that's asked on the HESI is TB. So we've given extended information, extended detailed information about TB. How do you perform a test? How do you read the test? When do you read it? What are you supposed to be looking for? How do you interpret the results? Okay, modes of transmission of infectious diseases. Talk about STDs. Okay. So infectious disease topic or concept. And then we look at the concept of disasters. Right, there's several questions, there appear to be several questions or topics identified in the HESI related to disasters. Okay, so make sure you look through this section. What are the stages? What am I trying to say? What are the stages of a disaster? Preparedness, recovery, right? It explains all of that in here. Okay, what's our role in professional preparedness? What's the role of the community nurse when a disaster strikes? What are the 2 types of disasters? Natural and man-made, right? How do you personally prepare? How are we, Red Cross ready? What does Red Cross ready mean? Okay, what is if we're helping families put together a kit, a preparedness kit? We just had an exam question on that in exam 3. What needs to be, what do we need? How do we teach families, community members to be prepared? Okay. So our stages are preparedness, response. And in each of these stages, it goes through what our nurse's role is. And recovery, what's our role in recovery? So again, you need to read through this. I'm just breaking it down for you. Okay, what's our role in recovery? What are some levels of prevention examples related to disaster management? Okay, there's your primary, secondary, and tertiary. What populations are greatest risk for disruption after a disaster? What if it's what if it's a terrorism or bioterrorism disaster? What's the role of the nurse? Here's some bioterrorism agents. Okay, we added this in. We may not have covered this specifically in class, but we extended this information in the study guide because one of the topics that came up or an area of questioning was in bioterrorism agents. So we added that into the study guide for you. Okay. And then this section here on page 36 talks about what are the components of outbreaks and illnesses. The last part of this is triage. How do we triage? Do you know what are the different priorities in triaging? What's the highest priority mean? What does the second priority mean? What does the last priority mean? Okay, and then this is a nice summary here on page 37, review of disaster nursing. Okay. And then they've asked about, there's a question, there must be a question about cholera in disaster situations, and I'll cover that on the spreadsheet. What's cholera?
It's the intestinal disease spread by a parasite.
Mm-hmm. What symptoms, what might be some symptoms of cholera?
Dehydration, nausea, vomiting,
Diarrhea.
diarrhea.
Yep. Okay. What do you do at the institutional and community level with regards to infectious diseases after a disaster? This is what this goes through. Okay. And here's what to do at a personal level, what not to do. And again, we're back to triage. We need to know about the tags, right? Triage refers to the evaluation and categorization of the sick and wounded. There's a color coded system that's used for mass casualty situations. Please have an idea of what each of the tags are. What's a red tag? What's a yellow tag? Green, white, and black. And we give you the answer right here. We break it down for you. You just need to know that. Okay. The next concept we talked about is culture. We talked about this all term. Okay, in our diverse world right now, we are going to be taking care and communicating with people from every culture, right? So this talks about how to be culturally competent. What do we need to do? Okay, what is culture? What are some different examples of culture issues within race, within ethnicity? What's cultural diversity? Cultural communication, cultural space. What are people's needs? What are culture's needs? What are their values? What are their beliefs? Again, when you go through this shouldn't be unfamiliar to you. It's full of detail. It's just an extended version of what we taught. But these topics, these concepts shouldn't be unfamiliar to you. Okay. What's cultural competence? Right? What are the 10 standards of social justice and human rights? All righty. Nurse must be culturally competent for several reasons. And there's your reasons. We've talked about every one of these. How do you develop cultural competence? And what are the 3 stages of cultural competence? Right? You may start out being culturally incompetent, and then you become culturally sensitive as you're developing your cultural awareness, and then you become culturally competent, or hope to be. Okay. And here's, we talked about this in class. What is this competence model, right? How do you develop cultural awareness, cultural knowledge, cultural skill, cultural encounters, cultural desire? All those must be present for you to be culturally competent. Okay, and what are the dimensions of cultural competence? Again, I know this is a lot of reading, but they're going to ask about this in the HESI. And I really hammered this home in my classes, the issue of being culturally competent. How do we get there? How do we develop it? What happens if you can't be culturally competent and you're culturally incompetent? Think of all the barriers, the problems, the issues that will come up. Okay, and here it is, your inhibitors to developing cultural competence. We went through these in class, and you had an exam question about it. Okay. Next concept we went through was rural versus urban. Right? What's the difference? What's healthcare look like in both areas? What does an immigrant, what does an immigrant need? What does a refugee need? Population characteristics for a rural population, right? We focused a lot on that. Health status of rural residents, women's health and maternal and infant health in the rural area. This is what this whole section is about. Okay, it's about the rural healthcare system, health of children, mental health in the rural areas. And then we talked about occupational environmental health in the rural areas. So again, this should be familiar information to you. And if it's not, go back and listen to the recordings of those weeks because it was covered. Okay. What are rural healthcare delivery issues and barriers? Okay, and then we talked briefly about migrant farm workers. What's the characteristic of the migrant farm worker? What's a migrant lifestyle? Housing issues, issues with migrant health, barriers that lead to health problems with migrants, lack of knowledge, inability to afford care, availability of services in the rural area, transportation, language, talked about all those barriers. And then the last part of this section goes through nursing care. What's our role in the rural environment? What could be our role in the rural environment? Next, there's two left. Next concept would be federal agencies. We talked about these federal agencies. These are the ones that you need to be aware of and what services they provide. Right. So we all know that Department of Health and Human Services is what guides our overall practice. Right. And then we have the CDC, we have the National Institute for Research, we have that Health Research and Quality. Okay. We have OSHA. We have the FDA we talked about, the EPA we talked about, CDC, right? Remember, we have World Health Organization is global. Then we have our federal agencies, and then we have our state agencies, and they all go all the way down to the local level, right? Okay, and then we have our voluntary and private nonprofit agencies. This little section talks about insurance and financial assistance. Okay, we need to be aware of those in the communities we practice in. What are our resources? How do we get people signed up for Medicare and Medicaid? Insurance if they qualify for it. Okay. And then the last section is community assessment. I'm not sure why this is last, should be back at the top, but again, this is our last concept covered in the study guide, right? Why do we do a community assessment? Why is it important? What is the process? Think of your ADPI, right? Assessing the community health needs requires the following steps. Goes through the 3 of them. You have to gather information, come up with a database, and then identify our community problems and strengths. How do we do data collection and interpretation? Remember, we have data gathering and data generation. And that's right here. Here's a windshield survey. What is a we should know this by now, but reviews what a windshield survey is. That's how we do. That's one of the primary things we do for community assessments. We start out with a windshield survey. Everybody should be familiar with that. Okay. Here's our box of examples of group role behavior. What, think of your group activities this term. What role might you have played? And going forward, when you in nursing, we're participating in group activities all the time. So here's some examples of roles that you might play in a group. Here's a couple of pretty common occupational exposures for occupational health. What are farm workers and chemical workers exposed to? What might they have as work-related diseases or conditions down the road? And then Medicare and Medicaid. The last part goes through what's the difference between Medicare and Medicaid. Okay, because that's important to know as part of your community assessment. Who qualifies for Medicare, who qualifies for Medicaid? That's a large part of your job in the community, is helping people with insurance. So you have to be knowledgeable about what they qualify, what they apply for, and what each of these 2 main what they cover, what services they cover, what services they don't cover. Okay, and this is a nice little box here, box 2.1 on the last page, Medicare and Medicaid at a glance. It's a nice summary. And then we specifically mention WIC, because there's some information that we've gathered that they ask about women's and children's resources. So we've put a little, what is WIC? We'll put a little paragraph in here about WIC. We've all heard about WIC. Okay, so that's how your study guide is broken down. We've tried to organize it into the most common concepts we have covered throughout the term. Does that make it a little less overwhelming? Or have you already figured that out? Anyone? Okay. Well, then we'll go to the next one. We're going to go through this Excel spreadsheet now, which, like I said, is we have reviewed HESIs over the last couple of years, 18 months to 12 to 18 months. And we have come up with a common list of topics, concepts that they're asking about. Again, we have no idea what the question is. So we could talk about what kind of questions you might get, but these are the topics. And this is not all inclusive. We've pulled these out as common themes. Okay, so it's broken out into 6 categories. We try to kind of stay with the path of the study guide. So we have community, vulnerable populations, disaster, child development, geriatrics, and infectious disease. Okay, so all of these we're going to go through real quick, should be in your study guides. Okay, so don't worry about all this verbiage at the front. This is just where they were found on the HESI. So we're going towards the end. So community assessment. So exam question, specialty area and topic. Okay, so this is in the community. section. So they're asking something about community assessment. I don't know what it's going to be. What do you think it could be? What are the steps to do a community assessment? What are the first steps? What do you have to do? What do you think? What's a community assessment? So this is the interactive part. I'm not doing all the talking here. I've already done all the talking with the study guide. So I need you guys to let's dialogue about what they might ask on your HESI about community assessment.
Assessment. They're gonna ask age, gender, race,
Sure.
what they do for extracurricular.
Okay. Anybody else want to add to that? Okay, I'm going to go through this quickly if you guys aren't going to participate. So the next topic is going to be, or the next topic could be the nurse's role. And remember, we're in the section of community. So there's something about the nurse's role. Maybe what is the nurse's role in community assessment? What's the nurse's role in community health? Community-oriented nursing, community-based nursing? Okay. Income. How do we assess income? What do we know about income with regards to the community? What do we know about that?
Isn't it a way how we determine like poverty guidelines to see
Exactly.
like what programs and stuff that they're eligible for?
Yeah. And assessing income will give us an idea if they are in poverty. And we discussed all term that families living in poverty create lots and lots of issues and challenges, right? And then here, line 8 is your eco map. So we need to know what your eco map is. You need to know what your eco map is. I think that line 9, voluntary agency, is about partnerships. That's what I think that's about. You know, your passive partnerships, your active partnerships in the community. That's what I think it's about. I don't know that. Anybody else have any thoughts about what voluntary agency might mean?
I think it's just volunteers, isn't it?
Well, again, it's your
Volunteering.
it's your partnerships. It's your, I think it's your partnerships you form in the community, your agencies, your volunteer agencies that participate in helping out in the community. What about program goal setting? Why might that be important? Do you
To
guys
see if
understand
you're-
what we're trying to do here? I'm giving you the topics that are being asked about. We're trying to come up with what might they ask about in that topic.
To see if your goals were met. You have to set goals in order to see if they were met, maybe.
Or what maybe what go ahead.
No, that's it.
What about the early stages of program development? Right? What comes in the early stages of program development? Well, if you're thinking ADPI, you're thinking goal setting, right? Advisor role, I'm thinking more advocacy as well. That's what I'm thinking for line 11. Advisor's role, that's where I'm thinking they may ask about what is an advocate? What do you do as a nurse advocate? I don't know that, but that's what I'm thinking it might be. Line 12, outcome evaluation. Why is that important? Why are they asking about that?
That's probably the one to see if the goals were met.
It's the end part of your ADPI, right? You're always evaluating to see if your interventions or your program outcomes or your objectives were met. Again, another one, community risk findings. I'm thinking that would be maybe part of the community assessment. How do you assess for risk? Environmental risks, safety risks, blood pressure screening for healthy people. What might that, what do you think that might entail? Okay, exercise and hydration. Think about that. Maybe why you should stay hydrated when you're exercising, or maybe what are the signs of dehydration, right? It's coming from a med-surg standpoint, talking about cardiovascular with exercise and hydration. And then radiation exposure. What might they be asking or wanting to know about that? Just to make sure you know about radiation exposure. Okay, I'm going to keep going. Homeless, we're in vulnerable populations now. The topic that's come up is homelessness, cold exposure risk. What do you think might be important to know about that?
Well, how you're going to treat if they get frostbite or something, maybe.
Mhm.
Is that what they're talking about?
I don't know. I don't know. That's for us to figure out. That's what we're trying to do here in this review, but we're not getting very far because nobody's participating. So, you know, what might they ask about homelessness, cold exposure risk? I don't know what they might present with at the ER. What are symptoms? What are signs and symptoms of exposure risk? Why, or what are the groups of vulnerable populations that might be at risk for exposure? Next is migrant worker risks. That's in your study guide. Community resources, rural, that's in your study guide. Culture, Hispanic. Hang on one second. Okay, sorry about that. Vulnerable populations, the Hispanic population, Islamic faith, culturally sensitive teaching. Okay, these are topics that have come up. Battering communication, what might they need to know there? Or what might they be asking about that? Can you recognize signs and symptoms of a battering an abusive relationship? What kinds of communication might you observe that are problematic? And then another topic that came up was home health, the dying client. Another topic that came up was geriatrics, the elderly, home nutrition. Okay, disaster, natural disaster. I'm just going to go through these since nobody's participating. So natural disaster preparedness was covered. And here's where I told you in the study guide, cholera is covered in some way. Not sure what they're asking about, but cholera is covered. So you should probably know what that is. And then your tags, here's your disaster tags. And then possible terrorism, that's in your study guide as well. Talked about terrorism and bioterrorism. So that's covered in your study guide. Then child development. So we're in child development, they're asking about screening programs. Maybe what kind of programs you screen for in the kids. I don't know, height, weight, BMI, vision, hearing, maybe scoliosis. Okay. Diet, this is again with child development, diet and stress with the kids. How do you teach a heart healthy diet? That was on there. Again, I don't know the question. I don't know how it's asked. What do you do for pre-adolescent teaching, adolescent teaching? That's all in your study guide in your first section of health risks across the lifespan. So go back and read those
Nutrition,
sections. Pardon me?
nutrition,
Yeah. Yep. If you go back to your study guide, yep. That what would be we teach for, what are some adolescent health teaching? Well, we know that one of the risks in adolescence is accidents, motor vehicle accidents. So that's maybe where we teach seatbelt safety. Okay. Seatbelt safety here for adolescents. Why would they ask? What would be important? Why would it be important for them to be asking about neighborhood safe houses? What do we need to know about that?
Maybe if they don't feel safe at home or at school or with friends or walking down the street home from school, they know somewhere they can go.
Yep. Yep. Excellent. Yep. Nicotine. What are we teaching about nicotine? Maybe we're, I don't know, primary could be teaching about the prevention of not smoking or what the health risks potentially be if you start smoking, right? Or maybe it's a tertiary question. You know, if kids are already smoking, how do you get them to quit? What resources do you have for them? And then there's a question about lice. Have no idea what the question is, but it's being asked. So maybe how do you screen for it? What do you do? What communication do you give to the parents? Same with skin health. Okay. Same with scoliosis, ADHD. All these are topics that are covered on the HESI. Eczema. This is all in your study guide. Immunizations. That's in your study guide. What do we know about immunizations? What we want to communicate to parents is vaccines are the most important, right? Most important prevention against childhood illnesses. Why are they asking about immunization rates? And then there's a question about, it has been a question in the past about the hepatovax B. And what does an allergic reaction to that look like? Conjunctivitis. How do you assess for conjunctivitis? Since we found that on the HESI, that's why we put in a question on exam, is it on exam 3 about conjunctivitis, or maybe exam 2? How do we get family assistance for ophthalmic medications? So maybe they're asking what resources might the nurse provide that might be available to help families, I don't know, paying for medications? I don't know. What do you guys think? And then lead poisoning. They're asking about lead poisoning. Maybe what are the signs and symptoms of lead poisoning? How do you prevent it? Okay, the next section is geriatrics. How do we do an elderly health assessment? Or they're asking about elder health assessment. They're asking about community senior health screening. Teaching with the elderly, skin health, safety. Home care referrals. Family assistance with maybe costs. It's the same thing, ophthalmic meds. So maybe if the family's not able to pay, what resources, do we have resources as community public health nurses to provide assistance to those families so they can get their medications? This would be a hygiene safety question about diabetic foot care. There's some kind of question on the HESI that has to do with diabetic foot care. And same with Parkinson's. How do you care for clients with Parkinson's in the home. They're asking about orthostatic hypotension. Maybe what is it? What are the signs of it? What are the numbers that have to be in play to have orthostatic hypertension? How do you treat it? How do you prevent it? I don't know. I'm just throwing that out there. And then here it's underlined secondary prevention for hypertension. What might that be? What might be a secondary prevention activity with regards to hypertension? What's secondary? Okay. Cardiovascular disease in African Americans. Why are they asking about that? That would be a med-surg question.
Sorry, in answer to your previous question, secondary would be screening. So you might want to screen for any long-term chronic illness that the hypertension may be causing, heart weakness.
That's exactly right. That's a good, thank you. That's exactly right. If it's a secondary prevention question with regards to hypertension, you should be looking for an answer that involves screening. Right? Yep. Cardiovascular disease in the African American population. Why are they asking about that? Maybe the prevalence, maybe the age, common age, onset, maybe the mortality. And then they're asking another med-surg question with regards to cardiovascular and endocrine, something about lipid screening. Influenza prophylactics. So this, I'm thinking, is probably about flu shots in the geriatric community. Maybe why is it important? How often do they have to get it? Who gets it? Who doesn't get it? Then there's something in there about elderly relocation, which we talked about in class, that relocating the elderly can be extremely stressful. Lots of issues that come up with it. Okay, so I would go back and review, it's in your study guide. Review the challenges of elderly relocation. Next is clients with COPD. I'm on line 23. What do the ADLs look at home? What do they look like at home for COPD patients? Still in the elderly section, long-term care fall prevention. Maybe this is about doing a safety assessment. Maybe what activities, when you do your assessment, what do you look for as risk factors?
Stairs, rugs, loose flooring, stuff like that in the home.
Yep, exactly. Yep. What are community resources for the elderly? The next line, I think, answers that question, which is, I would know what Meals on Wheels are. Everybody know what Meals on Wheels are?
A meal delivery service for elderly patients who can't cook or maybe don't have access to groceries.
Yep. So maybe they're asking what would be a resource for food support for the elderly, and the answer would be Meals on Wheels. I don't know if that's a question, but they're asking a question specifically about Meals on Wheels. Maybe what kind of program is it? Who provides it? Who's eligible for it? Teaching an ascites diet, right? If somebody has ascites, you're obviously teaching them about a modified home diet. I'd be familiar with what kind of home diet would be teaching about with clients with ascites. Anybody know?
Is that like the small frequent meals, or is that more of the types of food?
Both.
Oh.
Okay, so you need to go back and research that. Okay. So here's a question within the elderly population of a primary prevention question with regards to cancer. So what might that be? What are we doing in primary prevention with regards to cancer?
Maybe teach about nicotine and how it can cause cancer, sun damage, all the risk factors.
Yep, prevention. Yep, Absolutely. Okay, and then the last section is infectious disease. Some areas that are covered are pelvic inflammatory disease risk factors. So I would know those. Epidemiological triangle. What about flu vaccines makes them a priority? I don't know what the question is, but why are flu vaccines important? Who is the most vulnerable population that should be getting them? Maybe what population is a priority to get the flu vaccine? And then here's a couple of questions on TB. What is what they're asking about a screening x-ray, follow-up. So that's why we added all that information in there about TB. When do you follow up? When do you read it? What is it? How do you read the results? How do you interpret the results? When is a screening x-ray done? What are we looking for? Okay. So I don't know if that's helpful to go through those topics, but that is what we have found in HESIs over the last couple of years that are common themes of questions asked, or not questions, topics that are addressed. Again, I have no idea what the questions are, zero. So is that helpful to go through that?
Yes, it was.
Anybody else? Okay, does anybody have any questions?